Welcome to Health Strategy TV. Today I'm joined by Mike Farrar, who is the Chief Executive of the NHS Confederation. Welcome, Mike.
Thank you.
We've recently seen the passing into law of the Health and Social Care Act. That's going to bring some considerable challenges, particularly for the NHS leadership. What needs to happen? How do NHS leaders now need to behave and act?
Well, I think there's been major controversy over the Act, and a lot of people are worried that it's got some deficits in different places, and the architecture looks complex, and we're losing bits of the structure that we've loved for years, and we're getting new ones that we don't know how they'll work. And I think this is a time when actually leaders need to step up. And the truth is that they have to make the system work. So my call, if you like, to leaders is, forget the facts as to whether or not you like this architecture, forget the facts as to whether it came out of a political party you support or don't, but actually just remember why you do the jobs you do and find the way to make this architecture deliver the right thing for patients. And I'll give you a very good example of that. People worried about the absence of a strategic body to do strategic oversight and sort of like systems management, but there's nothing to stop individual chief executives, individual clinicians meeting up with their colleagues in other organisations informally to say, well, let's talk to each other about what our plans are, how does that impact on you, what can we do to support you in that change, how are we going to make this work when we all put our plans together. You don't need a physical body, a statutory body to make that happen. We can do that informally. We can make it happen because we've talked to each other. So I think the behaviours of leaders is going to be critical, because if there are deficits in the architecture and the thinking that will emerge as we try and implement it, the only people who are there to put it right are us.
Mike, you have given a presentation today. What are the salient points that you put across?
Well, I guess the key thing I was trying to convey, which I hope came across, was the idea that we can't carry on dealing with these really tough healthcare issues in the way that we've done them over the past decade. We know the financial challenges are going to force us to think differently. But what I was trying to get at today is actually the relationship which service users will have with our services is going to change in a profound way. And we need to be ahead of that. We can't be reactive to that. If we're going to be successful. So that's what I was trying to describe, and think about what are the implications for the informatics community in those changes.
So what are the implications for informatics, for ICT, and for the commissioners, particularly clinicians, who need to get to grips with and understand this technology?
Well, I think rather than seeing this as a sort of technology in the way that people have described it as a new widget that changes things, I mean, inevitably there will be some of that. The diagnostic equipment and the size and the availability of that is changing, and many things you can get on the high street. But it's more about the fact that it delivers information and knowledge to the patient in a way that used to be the preserve of the professionals in the service. And so in a way what the informatics community is doing is it's facilitating a revolution in the information between the patient and the doctor. And this will change the expectations of the patient, their understanding of what they should get, indeed their own connection with their own health is all going to be changed with that flow of information and knowledge.
What are the advantages of engaging patients in their own care, and how can that save money?
Well, I think there's a lot of evidence emerging, not just at the kind of self-care end where people are looking after themselves without using any services. I think in all aspects of our care, even if you have a serious problem in a specialist tertiary centre, the more understanding you have of that problem, the more your family and carers can be around to support you deal with that, the better the outcomes. And I think you can see that all the way down the line. And I'm a great believer that if we want to tackle the problems that we'll face in 50 years' time, we've got to create people who are managing their own lifestyles in a different way, perhaps thinking a bit more about their diet, their alcohol consumption, dare I say it, in the way that 30 years ago people had to start thinking about smoking. And one of the ways you can do that is by giving people more information and connected to them on an emotional level, not just giving them knowledge, but actually helping them understand what it means to use our services differently.
And to what extent are clinicians up for that?
Well, I think this is a great challenge for clinicians. At the moment, the kind of zeitgeist of the NHS reform is clinicians in control. But actually this does threaten clinicians. As a manager, You know, I've been serving the public and thinking I've been serving the public. My legitimacy comes from the fact that I get the powers from Secretary of State to do my job. Clinicians get their power because they have expertise, you know, and if you start challenging the relationships between the patient with the information and the doctor with the expertise, it's quite uncomfortable, and I think we have to help our clinical colleagues understand that this isn't undermining of them, it's helping them to get the outcomes that they came into the profession to deliver.
We're here at the Healthcare Strategy Forum. That brings together suppliers to the NHS together with leading decision makers. What do you think of the format?
Well, I'm a big fan. I'm a huge fan. I think the more that NHS leaders, whether they're clinical leaders, whether they're informatics specialists, whether they're chief executives, get together with the industry to understand the nature of what I would call the art of the possible and find ways to make it happen quickly, the better. And I think there's a great opportunity for people from the informatics field to get the bigger context, to understand how to shape what they're doing in that context, and to make sure that they're getting support. So, you know, when they have ideas and joint ventures and things that they think will make a difference, they can do it because the system understands it and supports it rather than despite it. And then they have to struggle and sometimes fail. So I think the kind of idea of the forum is tremendous, and I'm very, very pleased and in fact privileged to speak at it.
Okay, and is there anything else that you'd like to add that you haven't had an opportunity to say?
The only thing I'd say in the forum in the Olympic year is that, you know, I do a lot of work with my sport and health role with some of the elite athletes, and they have a very interesting view of challenge, which is the more challenging it gets, the more it inspires them. You know, and I think somehow NHS leaders, informatics specialists, we're going to have to find that energy and that sort of inspiration in the challenges ahead, because we've never had more challenging times, but never more reward for getting it right.